Welcome to Thursday's edition of Ask the Expert. Dr. Walter Tom is our aesthetic laser and vein center expert today here on 1350 KSRO. You can visit Dr. Tom's website at laserandvein.com. That's laserandvein.com. Or call 542-VEIN, 542-VEIN. And you, too, can look younger by Monday.
Thank you for coming and being our guest host.
Thank you. Thank you for inviting me. I'm delighted to be here, and I understand we're going to talk about the neck today.
Yes, a favorite topic.
Yeah, especially for women over 50. And we can't talk about the aging neck without mentioning the wonderful, the glamorous, the glorious Nora Ephron, who just came right out and said, I hate my neck.
That's right.
And most women over 50 hate their neck. And she also said the face may lie, but the neck tells the truth, and you can never own too many black turtleneck. So tell me, can you explain what happens to the neck as we age?
Yes, it's so interesting how the neck is an area that's a major concern for ladies. And I'm an aging baby boomer, everybody. And
you never know what to look at.
Okay, well, thank you. Okay, you're hired. You can come back again. Okay, thanks, Shannon.
You already hired me 5 years ago.
That's right. So, anyways, the neck is actually just a continuation of our face, is what it is. Obviously, we have a little bit looser skin in our neck, even when we're as young as our producer, Michael, who's 26 years old. But we got to remember, we're turning our necks right and left. We're bringing our chin down to our chest. We're looking straight up. So our skin tends to be stretched by all of these chronic movements. And then secondly, in the past shows, we've talked about what happens to our face is that we lose volume in our face as we age. I always tell people to look at their high school graduation photos. And for most of us, our bodies are thinner. And
yes.
Our faces are really full. In
yes.
fact, a lot of times I'll say, I bet you when you were 17 or 18, you didn't like your face because you thought it was too full or you didn't like your cheeks. And now you realize that was all the part of our vibrant youthfulness was that full face.
Yes, the baby fat.
Exactly. And so as we get older, it reverses. Our bodies get bigger and our faces begin to deflate. Well, our faces are in continuity with our neck, so it's really a cosmetic unit or an aesthetic unit together. And so as we lose volume in our face, we also lose volume in our neck. That's why we begin to see the muscles underneath the skin of our neck a little bit more prominently. Some ladies will complain of a band, and men will complain of a band. In fact, this is an area, by the way, we've said ladies, but I have to tell you, as we get a growing number of men coming to our office, this is one of the areas where the numbers are about the same. We get both men and women coming in complaining about their neck or just under their chin. So
yes.
This is a common area for all of us. As we lose volume and we see the muscle, we begin to see the muscles underneath, and we see these bands, which, by the way, those bands can be very easily treated with Botox. Okay, so if you have those bands, well, no, Botox actually relaxes the muscles. So then you won't see that band as much. Okay, and if it's not right for you, of course, we'll tell you. But that's something that can be done. But then as we lose that, we also tend to get the sun damage. If you think about it, even in terms of our care, most of us wash our face, how many of us actually make sure that we're also washing our neck area?
Right.
And when we put on our sunblock, we're all usually pretty good about putting it on our face, but how many of us are good about also continuing down below our jawline and putting sunblock on our neck? So all of those factors, along with age, leads to sort of the aging neck.
Yes. And also, I remember from my days in beauty school, the neck and under the eye are the two places where there's no bone for the skin to adhere to.
Correct. And so you're going to see a little more sagging as well. That's a great point.
It seems like there are different stages of aging in the neck. And so if you're just starting to get a little bit of the crepiness and maybe a little bit of the waddle, what can you do?
Okay, great. I love the way you're approaching this. Those early stages. So number one, sunblock. Okay, so that's really important. People, remember to put sunblock on your face and your neck, and you should do it 2 or 3 times a day. So that's number one, especially living in beautiful Northern California. Secondly, Thermage. And we've talked about Thermage in the past. Mm-hmm. Thermage is a radiofrequency device. It's not a laser. It's a radiofrequency device which actually heats up the skin with radio waves and causes it to contract or tighten. So what it's doing is it's causing damage of the collagen in our skin so that it will regrow and rebuild in a more organized fashion. And I equate that to going to the gym and working out. And so we lift weights. Okay, you're pumping iron. All right, Shannon. Right. And so what happens is, why are you sore afterwards? Is because you've torn down your muscle fibers. Then you're not supposed to pump iron on the same muscle groups every day, and that's because you're supposed to allow recovery, and that recovery is that those muscle fibers will then re-heal, and they will become fuller, more toned and stronger. So It's the same concept of what Thermage is doing to our skin collagen. In fact, I just spoke to a patient on my way in here as I was trying to rush through the Sonoma County fair traffic to get here. Right? Exactly. Yes. I'm getting here just in time. But the patient told me that she couldn't believe how soft her skin felt afterwards, that the texture seemed to be improved. And that's just from the Thermage causing collagen contraction. The heat also causes a little bit of good swelling in the skin, so it looks more youthful as well.
What does it feel like? It's a radio frequency machine. I've seen it looks like a wand.
Correct.
What does it feel like? Okay,
well, what you will feel is it's phenomenal technology, and they've just upgraded it, if you will, so that it's more comfortable. But what you'll feel initially is you'll have almost like a mineral oil just to cause an interface between your skin and the wand, as you call it, or the handpiece. Right. So you'll feel a cooling spray initially, then you'll feel a little warmth, and then it culminates in a quick little hot pinch as the total amount of energy is delivered, and then a quick cooling spray. And all of that occurs in less than 1.9 seconds. So it's very quick.
Okay. And so how long, if you were going to do the neck, how long does it last?
What I kind of tell people is to expect the results to be for a couple of years. So doing Thermage maybe every couple of years is great. There are some celebrities who do it more frequently. Initially, it was Ellen Barkin, who had done that. And now, actually, the big spokesperson, unofficial, is actually Gwyneth Paltrow. And she does Thermage frequently in order to maintain the tightness of skin and all. And especially for her being sort of the Northern European blonde hair, light-colored young lady, doesn't have a lot of volume in her face, so the Thermage helps to keep her skin toned.
Okay. And the actual procedure, if you're doing the neck area, how long does that take? 5 minutes, 10 minutes?
Great. So because of the number of pulses, you're going to treat the face and the neck together. So it's a little bit of a twofer. So what you're doing 2 for 1, in that you're treating the entire cosmetic unit area. So you're looking about an hour and a half to 2 hours with us.
Okay. So you're doing the whole face and the whole neck?
The whole face and the whole neck. So you get a little bit of improvement around the eyes. You get a little bit of improvement around the cheeks, around the mouth, as well as, most importantly, the jawline and the neck area.
Yeah. That seems to be aging first. You start to get the jowls, and then you get the crepey.
Right.
And then you get the turkey waddle, and it just goes downhill from there.
and that's actually just the end result, because you're beginning to see the deflation of the face. So our consultations are always free. They're complimentary. Come on in, and we'll evaluate the entire face and neck area for you.